Hey, it's Dr. Dan Purser, danpursermd.com. We're going live now. We're going to talk about fertility and miscarriages and pregnancy. That's what we're going to discuss tonight. I know it's hard to cover all that in a little over an hour, but let's see what we can get going here. Thanks for everyone being here. I know you're all dying to find out what's going on with all this. So what do you think the number one cause of loss of libido for females I see in my practice? What do you think it is?
My guess is low progesterone. No,
What?
Libido would be testosterone. No?
That's not a cause.
Oh, cause.
So what's that's just another finding.
Symptom?
That's a sign, actually.
Okay.
So signs are what you...
Yeah, explain this.
A symptom is what the patient complains of. They're not going to come in and go, I feel like my testosterone's low. I feel horrible. They don't know that. It could be high, and they could be saying that. So they're saying, I don't have libido. I'm not attracted to anything. I just want to go home and be a stump. Watch cartoons with my kids or whatever.
Yeah.
So that's a symptom, low libido. A sign is low testosterone. That's when the doctor picks it up on lab.
Okay.
So what do you think the number one cause of low libido or loss of libido in females that I see in my practice? What do you think the number one thing I see?
Is it a common one that you always see? Is it MTHFR?
That's a really, really root cause
Okay.
for a lot of them. But yeah, it's vitamin deficiencies.
Of course.
It's by far and away the number one cause. Next would be ovarian damage or pituitary dysfunction. And that gets a little hairier, a lot. And you just got to go with HRT and some other things at that point. But not always. So the number one cause of infertility for females that I see?
Vitamin deficiency.
Oh, you got it.
Is there specific ones, or does it kind of depend on the case?
Probably the most common is B12, folate, pantothenate, serine, amino acid, really not a vitamin, zinc. Those are about the top 4 or 5.
Interesting.
Maybe a D3 deficiency. So now the hard question: what causes these vitamin deficiencies? Think of the music playing from, what's that show?
Jeopardy.
I love that show.
Did I hit it earlier with the root cause?
Well, you tell me.
Is it genetics?
Take a guess. I'm not going to get. Oh, you said
genetics. I went with the big over the head.
Yeah. Among young living distributors, and people follow me, it's almost always MTHFR or some other methylation problem. They have it. Some of them have it bad.
Yeah.
I mean, like the worst I've ever seen. So,
yeah.
Yeah. So I just brushed the mic. Was that bad?
You're good.
It was just pins and needles in their ears.
Yeah, it scares me. So what do you think the number one cause of infertility for males I see in my practice?
I'm going to guess again. Oh, cause
of infertility in males.
Is it vitamin deficiencies again?
It is. How did you know that?
I've been listening, I think, today.
So
far.
Okay, now you should easily get this one. What's the number one cause of loss of libido for males I see in my practice, and most doctors see?
Vitamin deficiencies.
You're wrong. It's stress.
Is that a cause?
Yeah.
I guess, stress is a cause. I was going to say
blew
depression.
That completely. I handed it to you and you blew it. So you should have got it stress, not vitamin. What?
Hey,
No.
Every other answer that has been the answer, every other question.
You got sucked right into that one.
I
didn't
did.
you? That's how they get you in medical
You're
school.
tricky.
Too. Okay, so what is the number one major cause of stress I see in my practice in men? Number one cause of stress. Think about it. Easy, super easy.
Life.
I don't know about what? Life?
Number one cause of stress.
Life's too general.
Okay.
Got to be more specific. We're running out of time. These people are waiting for an answer.
Kids, family,
job, work is the number one cause of stress I see.
Makes sense.
In men. So what is number 2? You kind of vaguely said it with that money answer.
Money.
Finances.
Finances.
Finances, yeah. So what's number 3? You're right on track.
Family.
Wives.
You can't say that. No, I'm just
Well,
kidding. What's a wife's number one stress? Husbands. Just
No.
kidding. My husband just walked in the door right when I said that. I could not have been a better time.
Smile on his face right now.
Yeah, 100,000 people will hear this
Yeah.
now. So.
Thanks.
What's the number one cause of erectile dysfunction or ED I see in my practice?
Is it a trick question?
No.
Is it vitamin deficiencies?
No. No, it's the most obvious answer in the world.
Low testosterone?
Low testosterone is the number one cause of ED I see in my
I thought
practice.
that was a sign.
I'm amazed how many guys are given Viagra or Cialis or something like that. Makes me so mad. And I'm like, wow, well, your testosterone's 220. That probably has an effect on it. How's
Yeah.
the Viagra working? It doesn't work at all. I'm like, yeah, no, never going to work at all when you have no testosterone. So low testosterone is 400 nanograms per milliliter or lower.
That's low.
400 or lower, that's low. Moderately low is 600 or lower. Mildly low is below 800. Normal is above 800 nanograms per milliliter. So
And that's at any age?
let's say adults.
Okay.
Young men in their 20s is like BYU players or NCAA Division I football players. I see levels of 12 or 1,400 testosterone levels. So when I've seen an 85-year-old not on anything, he was in St. Louis with a 1250.
Wow.
So it was amazing. 1,250 nanograms per milliliter. Is that your husband? What's he doing?
He's moving
Moving the
something.
lights. Moving the lights. Okay. And,
You don't
did
recognize
that cause
him?
you stress?
He's in your house and you didn't recognize him?
I'm not looking at him. I have to look at the camera. So the dog's she's joking. Do we need a high liquor? I'm not looking at her. Okay. So you cannot maintain a functional erection with low testosterone. Not going to happen. So you got to find out what is the cause of the low testosterone. So I see all these young guys come into my practice on Cialis or Viagra or whatever, and no one's trying to figure out the cause of the low testosterone. So if you're not younger but older, we still need to figure out the cause or what happened. Is it pituitary? Is it vitamins? Usually vitamins. Number one cause of low testosterone, what I see. And that's caused by
Genetics.
genetic errors, yeah. Yeah, not genetics, genetic errors. Yeah, so these SNPs or errors I keep talking about, like MTHFR, like COMT, like all the stuff you hear about and read about online, these are really ancient. Some of these have been around for 1,000 or 1,200 generations or more, from Norway or Scandinavia or somewhere. Can you imagine? Because everyone who has C677T is related to everyone else who has C677T.
Crazy.
Yeah. It's
And
really...
there's a lot of people with that air.
There's a whole lot. In Utah, there's millions. In Young Living Distributors, there's probably 1 million. So okay. So the number one cause of low testosterone in men is, I said it a minute ago. Did
Vitamin
you forget already?
deficiencies.
Vitamin deficiencies.
That was my answer the first time.
B12, folate, pantothenate, the ones that are usually caused by MTHFR. So the number 2 cause of low testosterone I see in men is, no one knows. It's all magical. No. Doctors think it's magical, pituitary damage or testicular trauma. Some kind of trauma.
Some kind of injury?
Some kind of injury or trauma has occurred. So back to ED. The number 2 cause of erectile dysfunction I see. Number 2. They're older guys. Anyone out there guessing, trying? Number 2 cause, plaque buildup, arterial plaque. Arterial plaque, and you can't get proper blood flow to the man's penis. So what happens is it's got to be cleared out. So now there's a new technology. You got to check it out. If this is your hubs and he doesn't have any vitamin deficiencies, his testosterone's above 800 for whatever reason, and you're happy with all that, but he still has ED, look at Gainswave. Find a urologist in your area who's using the new Gainswave technology and have a procedure done. So, because what it does, it vibrates the shaft of the penis and stuff and gets rid of the plaque.
Crazy.
So, yeah, it's really cool technology.
Never even heard of that.
Yeah, I'm going to really be suggesting more and more and more as the months go by with patients. So, Gainswave is really cool. It's the future for dealing with ED. So, if you're 58 and you've had a coronary artery bypass or a heart attack or whatever, and you can't get an erection, you need Gainswave and not Viagra. You need Gainswave. You need to make sure testosterone's optimized. Do not believe those two horrible studies that have been wildly disproven that testosterone causes heart attacks. It does not. It reduces your risk for heart attacks. So, but and if you're cleared by your doctor, your cardiologist, get your testosterone up to above 800. Get the Gainswave performed by a urologist. It's natural. Well, I don't know if that machine is natural, but you're not taking drugs with it. It just clears out the circulatory problems down there. So it's really cool. So what's the female version of Gainswave?
I don't know.
It's called a mommy makeover. It's vaginal rejuvenation procedure. You can Google, because our office does it. I don't do it, but my partner does it in his team. The Aesthetica Mommy Makeover Vaginal Rejuvenation, and get an idea what's going on there. We're Utah, so we're super cheap, or Google someone in your area who does it. It's for if you've had a lot of babies and stuff like that, or if you got damage down there, whatever you've got going on. It's just a really cool option. So let's talk about recurrent early miscarriages, which I hear a lot about. It's usually, not always, but usually caused by low progesterone or lack of progesterone production.
And how are women low in progesterone? Or why?
It could be vitamin deficiencies most commonly. Maybe they're on the wrong kind of prenatal. So if birth control pills make you feel crazy, or you feel horrible on them, or you hate taking them or quit taking them, you probably have some kind of MTHFR methylation problem. Probably, I'd say 99% chance you do. So you're going to need either the Thorne or the Master formula right away. And I'd do it for at least 90 days before trying to get pregnant. So, okay, so your question was, why would they not make enough progesterone? Yeah. Well, it's all these endometriosis cases. It's all these PCOS cases we've been seeing and dealing with and helping with. It's lack of usually B12 and some other B vitamins. So it's in Master Formula and in MTHFR Sport Plus. It's in Super B. So, or they could have damaged ovaries and they can't make enough progesterone then, or they have genetic problems. So I've got probably more than 100 emails from women taking progestin plus who are like, I was able to maintain my pregnancy. I took it all the way through. Good. If you need more help than that, try that first if you're young living, or call us or email me or text me on Facebook or whatever. I don't know what it's called. Is it messaging? What do they do on Facebook?
Direct message.
Whatever. Yeah, do that, and I'll give you some other suggestions if you can't get Young Living Progestins Plus. But yeah, and sometimes some of you are going to need prescription progesterone, natural progesterone, to maintain that pregnancy. All of them are safe to take through the 9 months of pregnancy. So they won't suppress your own production. They'll just add to it.
Keep going.
So a woman before she's pregnant might have a 20 if she's really healthy, a level of 20 nanograms per deciliter, or 20, just remember 20 on her progesterone. On her last day of pregnancy, what could she be at?
Really
optimally?
high, really high.
How high is really high?
I feel like I'm going to either way over guess. Isn't it it's like 800 higher?
You're really close.
900?
It's 900.
I was going to say 900.
Yeah, so that's the difference between when they're not pregnant. So what are they the day after they're
Oh, it
pregnant?
Drops, right?
Yeah, what do you think it
back
drops
to
to?
like 20 or back to what
0,
it would be.
yeah.
Oh yeah, completely.
That's why someone get horrible postpartum depression.
Yep.
But the most common cause of postpartum depression is
would be vitamin deficiency, right?
Bingo, yeah, because they took the wrong kind of prenatals when they're pregnant.
Doesn't the baby deplete you of everything too?
Yeah, it sucks you dry. They're like little vampire sausages in
little
there.
Parasites.
Suck you dry. Yeah. So little
vampire sausages. Good to know. That's what you think of babies.
How many kids do you have?
Yeah.
So much trouble. Oh, I'm a dead man. Okay. But all the moms are laughing knowingly. Okay. So eclampsia and preeclampsia.
Wait, real quick.
Okay.
Got some questions regarding that.
Okay.
So prenatally wise, we need you need to find one that has a natural form of folate, not folic acid, right?
Not folic acid or not cyanocobalamin.
Yeah, because those ones that's what makes
Muy malo. Very bad.
Very bad. That was like the biggest thing people kept saying. I kept asking.
Right. So Thorne research, their basic prenatal is amazing, or master formula. Either way, you're going to have to take additional support. You're going to take, if you're not a young living, or you are, you can take MTHFR Sport Plus. If you have bad homozygous C677T and a bunch of other bad methylation errors, I'd probably dial in the Thorne research in the basic prenatal and the MTHFR support and Sport Plus. You're going to need a lot of it.
Yeah.
So we've seen that. We've seen that in our own family.
Mm-hmm.
So yeah. So eclampsia, preeclampsia, and MTHFR. If you go to PubMed and put in preeclampsia, PRE-ECLAMPISA, and then you also there's a space there, and then you put MTHFR, you'll see 124 articles come up. Why hasn't your doctor read one of those? So if you have preeclampsia, you should be asking them that. So the worst form of MTHFR seems to be the cause. C677T error, the big bad ugly. And you got to have a B12 deficiency, maybe a few others. So if you've had a history of preeclampsia, or you're worried you're going to have preeclampsia, or you've had preeclampsia and almost died, number one, you have MTHFR. You have C677T. Number two, get a spectra cell, get your genetic profile, get the foundation methylation kit. They're on sale now for how much? 49 off, 50 off?
50 off.
50 off. Grab one of those. Start with that if you want to. But get a spectra cell. Don't play around with this. It's deadly. And you can even do it if you're pregnant. So let's see what the results are. I would even, if I was someone that had preeclampsia before and you think you're flying right with, you're doing the master formula, you're doing the 2 Super B or 4 Super B or whatever it is, or you're doing the Thorne prenatal and you're doing 4 or 5 MTHFR Sport Plus, you feel really good. I'd still check at 4 months in your pregnancy a spectra cell. It's not worth messing around with them because it can kill you. So really critical that you do that. So that's what I would do if I was a woman who had a history of eclampsia or preeclampsia. It's in the literature. I just found that the other day. I feel stupid that I haven't known that before, but I'm guessing about 100,000 other doctors haven't seen it before too. So,
and would you say for like women who's have their mothers went through preeclampsia or like sisters, they should do that as well because it's generally very similar?
Yeah, be all over that. Let's talk. Call me. So that's why I think you ought to do all that. Get the foundation methylation genetics kit, get a spectra cell, go from there. I just talked to a couple of ladies this week who had preeclampsia, eclampsia. That's when I figured it out. I'm like, oh. So, yeah, it's because they were going, what's the cause? So let's talk. Easy testing, much grief saved, and much agony and risk of death saved. So take the correct prenatal, take master formula or Super B for men living, or Thorne research basic prenatal, and the MTHFR Sport or Sport Plus even. So if you have bad methylation problems, the lead up being homozygous C677T, you're going to need a lot more than just the prenatal or a couple of methylation sports. I track with testing. I would and I'd be all over it with more MTHFR Sport Plus or Super Bs. You need to feel really good all the way through your pregnancy, not butt tired, exhausted, crawling. And if you have a history of postpartum depression, you're not taking the right kind of prenatal. So I love all you guys. If you have infertility issues, ED, pregnancy, can't get pregnant issues, stuff like that, don't go get IVF right off the bat. It's like automatic. Y'all run and get IVF. In Utah, it's cheap. It's about $12,000, and In Nevada, it's 25. In California, it's 36 to 50.
There's better options.
Wow. And you could spend $1,000, really get a Pro 7 and I wouldn't even advise that. I'd get the methylation kit if it's an infertility issue, and the Spectracell, you're looking at maybe $900. And I get so many IVF failures, really, or maybe you just can't make enough progesterone for whatever reason. You just need a progesterone script. Super easy, and I've got, like I said, over 100 emails from either Young Living people or other people who've tried various forms of natural progesterone and gotten pregnant. So there's just so many cheaper options. IVF should be for just those who really, really, really need it. Make sure you don't have any B12, folate, pentatothate, any other weird deficiencies that you will not get pregnant if you have those. If you do, it'll be a tiny miscarriage. You'll never know it. So it'll be like a heavy period. So think before you do all this. So anyway, it can save you some money. I know you're going to spend some to save some, but that's what I do. So this is Dr. Dan Purser. I love you all. God bless and go in good health.